We, if it's okay with everyone, we will record this also. Mainly, we want to potentially take excerpts from some of this for staff training, and I don't know if any other kind of media posting on Facebook, that sort of thing, to try to get the word out. Is that okay with everyone? If you say something that you don't want posted or that you want edited, we have 18 minutes of tape that we can erase.
I knew I should have got a haircut today, Walt.
Haley probably should wait till 2:30.
Maybe just a few more minutes to see if anyone from Gatehouse joins.
Gatehouse, yeah.
Whatever they.
Right.
I doubt it.
Hi, Ernie.
How's it going?
Very well.
Excellent. I just was gonna see if it was okay if I did it. Okay. Yeah, I just got that locked back out. I figured.
Mike, I don't think it'll be. Might wait 2 more minutes.
Okay.
So I was golf this morning.
Well, not too bad. Pretty mediocre. I shot a couple of 44s. Bogey golf.
That's good.
I ran into several other High Plains employees out there as well. So I just with the second round, I was on 9, Vanellis and Matt Knoll and Reagan Schneider and Saki. I didn't have Saki played golf. And Brenda on Crawl out there golfing.
Yeah, we used to have center golf days.
Oh yeah.
We would went to Russell once, Ellis once, Runyon. Those were fun days. You haven't organized
I'm better playing by myself.
that. Okay.
See you later.
Thank you, Ernie. Well, good afternoon, everyone. Appreciate your joining us. My name is Walt Hill. I'm the Executive Director of High Plains Mental Health Center. I think everyone that's on, I'm familiar with, and probably you're familiar with me. We do have Christina Janning with Hayes Post, who is always very, very interested in our issues and does some very nice reporting here in the region on our mental health issues. So Christina, again, thank you for joining us. What do is to, I don't know if you can see other folks that are on the, okay. So we have a couple of guests joining us from afar. John Evans is the CEO of Innovatel Telehealth. We have a really good, strong relationship with them, and they're providing telepsychiatry, telehealth prescribing services. Helped us go from having 2 prescribers for medication services up to 7 with folks from around the country with incredible credentials and become part of our team, even though they may live in upstate New York or Texas or some Kalamazoo, but they really become part of our team. And that has really worked well to get quality staff who want to stay living where they live, but work in an agency like High Plains. John, do you have any comments?
Well, thanks, Walton. Again, it's really nice to be with you. And yeah, I think as a former CEO of a mental health center, have sat in your chair, and our passion is timely access to care. And we partner with clinics like High Plains all over the country to make sure that happens. So, your comments earlier, Walt, and Chuck's as well, really were meaningful in regards to that's the most fundamental thing that we do, is make sure that when people make that call, that our goal is that clinics like High Plains can say, we'll see you today. And I'm pleased to be in the partnership, Walt.
Thank you, John. But Christina, High Plains applied for a grant from Substance Abuse Mental Health Services Administration. I think we sent you the media release on that.
Yes, I've read it.
Okay, good. So you have some of that background information, and we did receive the grant. We have another grant outstanding for $1.5 million a year for 2 years to complement this, to do some additional things. We're still waiting on that. But we want to take the opportunity to talk with folks in the community, stakeholders in hospitals, representatives from our federal congressional delegation, Kyle Kessler and Michelle Ponce from our state association are on board. And last, but clearly not least, is Chuck Ingoglia, who is the CEO and president of the National Council for Mental Wellbeing. Chuck was here in Hayes about 18 months ago to do a keynote at our event on mental health and ag issues. I've known Chuck for many, many years. For a period of time was on the board of the National Council while he was headed up the public policy efforts. His public policy efforts have come to fruition, where he really shepherded ahead the community certified community behavioral health clinic public policy successes at a national level. Chuck is now the CEO of the National Council and is joining us today to kind of give a statement of an overview and statement of the vision of what community certified community behavioral health centers are all about. So with that, Chuck, can I turn it over to you?
Sure, Christina, I'll try not to bore you. And the other folks have heard this already. So, I just put to give some context, right? The grant that High Plains has awarded is part of a larger movement. There are now about 340 clinics in 41 states that are in the process of becoming certified community behavioral health clinics. It's part of a larger movement, to Walt's point, of how do we create an infrastructure in this country so that everybody who needs care can get it. Right now, only about 35% of people who have a serious mental illness are in regular treatment, and only about 12% of people with a substance use disorder are in treatment, in ongoing treatment. And so the idea behind the Certified Community Behavioral Health Center model is to make sure that everyone, regardless of their ability to pay, regardless of their diagnosis, regardless of the type of insurance that they have, can get access to high quality, evidence-based care when and where they need it. And so Walt is going to, and High Plains are going to be bringing that model to the 12 counties that they serve, 20. Oh, I'm sorry, forgive me. 20 counties that they serve, and it's a combination of not just the kinds of services, but the partnerships with community stakeholders, hospitals, and local law enforcement and schools and veteran serving organizations to really try to knit together a safety net so that everyone can get care, including 24/7 crisis response, which I think is really important because people can get sick at any time of the day or night, and you need to make sure that they can get into care. So maybe I'll just say that, Walt, and see, Christina, if you have any questions, happy to answer them.
So
Well,
at this
maybe Walt, do you want to just mention to Christina how there's a kind of larger movement in Kansas and how this is going to get sustained?
Sure. So as Chuck said, this is a nationwide movement. It's growing. It's doing it kind of a piece at a time. Different states are bringing on different numbers of community mental health centers in different ways, basically with seed funding to help raise the bar of increased services, crisis services, medication assisted treatment services for individuals with substance use disorder, with psychiatrists that specialize in some treating with some of the new medications that help people overcome addictions. That's where John and his company come in with a psychiatrist we've already retained for this. So in different states, it's rolling out in different ways. There are a few states that have yet to sign on. Kansas, there are, I believe, six of us now, 7 CMHCs that have gotten these federal grants as seed money. In our case, $2 million twice, we hope, to raise the bar to have assertive community treatment teams, a therapist, a nurse, case managers, going to people's homes. It's kind of like the crisis center on wheels, I call it. Goes to where people are at. Integrated health and health management services. People who have mental health problems often don't pay as close attention to their physical health. And so we'll be watching metrics of are they taking care of their health and getting in touch with them if they're diabetic and not getting their A1Cs regularly, that sort of thing. The crisis services that Chuck talked about, mobile crisis services. We will be working more with people in jails to hopefully keep them from staying in jail too long or even getting in jail. And rapid access. So that if someone calls for services at High Plains, our goal is that they will be able to come in today or tomorrow and be seen to get started in treatment. Across the country, it may be sometimes weeks to get in to be for a first appointment. And people, when they're ready for mental health, they're ready for mental health. Anytime it's like going to community care here. When you need to go and get things taken care of. And so that's our model. We'll be adding about 13 to 15 new staff positions, therapists and case managers and nurses. We've rented a wing of the Hadley complex for staff expansion. This is the first time in many years we've been able to expand with additional staff. We've usually been staving off trying to survive with cuts. And this is a wonderful opportunity to grow and expand, and then to have the services sustained through a whole new model of funding that pays for the costs of services as opposed to just eking by. It's very similar to the certified or the federally qualified healthcare clinics funding model that provides a cost-based reimbursement. So we'll be able to move into that. Kyle and the association and several of us have been working with the state on implementing that mechanism of funding to really sustain these initiatives, this growth for the long term. I don't believe just doing this for 2 years and then going home makes any sense. We got to sustain this. And what Chuck's been working on at the national level, Kyle at a state level, is a model that will sustain this so that more people who need mental health services can get the services they need. Only a fraction of people who need services actually engage in treatment and who want to be available. You know, our motto is we're here for you. We want to be here more for people.
Well, I do have a few questions if
Sure.
y'all indulge me. Can you kind of talk about what the status quo is related to some of these services? Like you said, people are waiting weeks nationwide. Is that true here in Hayes?
Yes,
Okay.
unless they're in an emergency, that is the case. It may be 7 to 10 days from the time they call to this, they're seen for an evaluation, unless they're in a crisis. But that is, I monitor that data every week and watch that, and that is the status quo. It's not good. It's not what we want.
Hey, Walt, can I just give you some credit here? There's some clinics in other rural areas that for child psychiatry specifically, it's months for the first appointment. And if you can imagine a parent calling for a child. And so really Walt and High Plains has done a remarkable job of improving access to care.
But it's not good enough.
Yeah.
Well, you also mentioned jails. Some statistics I've read in the past is that very high percentages of the number of people who do end up incarcerated, whether that's local jails or if you're talking about the state or even federal system, have some sort of mental health needs. Are you seeing that locally as well?
Yes, I think we absolutely see that. I know Sheriff Brown talks about the number of inmates in the local jail who are on psychotropic medications. It's very common. We want to develop a liaison that can help perhaps get those folks out of jail into treatment sooner. Through the ACT team, we hope to catch people who are becoming ill before they commit a crime and get help. Chuck just showed an overhead of a broken window of an individual he knew that person knew that's how he could get treatment, is he would go break a window and get into jail and then get help. And we want to change that so that people can know they can get in to us, or we can go to them and treat them today if they need, rather than having to escalate to a point of crying out for help and through their behavior.
Can I add something to that, Walt?
Absolutely.
Yeah, and so one of the other things, Christina, keeping in mind how this looks statewide, the Kansas Sheriff's Association, the Kansas Peace Officers Association, and the Kansas Association of Chiefs of Police were all significant supporters of our state legislation. And I believe the National Sheriff's Association supports the national legislation. So this is something that really is, I think, the intersection of criminal justice reform in our country.
One of the things, Christina, to point out is that there's a federal funding pot of money to raise the bar. The states then, and we can meet the criteria to be federally certified. The states will also put in place a state certification process to become a certified community behavioral health center, which then accesses the new Medicaid funding model. And Kyle and Michelle this year did yeoman's effort with our legislators who just, I don't know, it's credible support among the legislature in passing a bill that allowed the state to have state certified community behavioral health centers and a funding mechanism to sustain that. So we're seeing both at the federal and state public policy levels great support for this model. And as Kyle said, our stakeholders in law enforcement, we had several judges here in the room this afternoon hearing about this model. And, similar to drug court, we need to be more involved. helping people stay out of jail.
Mhm. You also talked about trying to meet the needs, the physical health needs of people, especially who may have chronic mental health issues. What is that looking like now? Is that really an issue right now? You're seeing people having a lot of
Yeah.
problems physically, in addition
Yes.
to comorbidity with mental illness?
Yes, the comorbidity of mental health and particular physical health issues, diabetes, heart disease, COPD, other problems is very high. So what we're trying to do is help make sure people get into the physical health care, improve their mental health care, help monitor some of the metrics around their physical health care, their A1Cs, and reaching out to them and say, it really looks like you ought to be getting in to see your primary care doc or your specialist to get your diabetes under better control. People who have chronic or long-term mental health issues typically die more than 25 years younger than the rest of us because of comorbid physical health care problems. And we want to help intervene in that. Not do the physical health care, but to stay close to those folks and say, we're really concerned about you. Things aren't going well. We want to call your doctor. We really need for you to get into your doctor.
Okay. And you decided that 12% statistic, I think it was, on substance abuse, only 12% of people with substance abuse. What kind of access have people had here in our local community to substance abuse care? And is it especially difficult for people who may have little or no income?
There are programs in the state for the uninsured, federal block grant funding for individuals to support their receiving substance abuse treatment, both here at High Plains, at Smoky Hill, Dream. It's one of the difficulties is stigma. One of the difficulties is that we haven't always had evidence-based practice to help people overcome their addictions. That's where medication-assisted treatment can come in, that you don't just have to pull yourself up by your bootstraps with moral will to overcome the darkness, that there's some medications that help change people's biochemistry, their neurological chemistry, to help them overcome. A lot of people, majority of people who have substance use problems, or 50% or more, have co-occurring mental health problems, and vice versa. So our goal is to treat the whole person.
Mhm. I know that you said that you were hoping to add new staff. A lot of industries in Northwest Kansas are really struggling to find employees right now, and these are very specialized positions. Are you concerned that you will have difficulty hiring for those positions?
Yes, it's a challenge. I never let challenges get in the way, and we're working on ways to overcome that. In part, working with John and his company who have staff in other parts of the country that we, so to speak, teleport in through telehealth. We're just working on adding therapists through his company and another company to do those rapid assessments of patients same day or next day. We're going to be working with another group that provides substance use counselors and has, so some of these will be companies we contract with to hire staff. We also are taking a multi-pronged approach with trying to raise compensation levels for staff to be able to attract staff. The second grant that we applied for would allow us large retention bonuses each 3 months to keep staff on board. And then when we get the bar raised, then we have the funding to maintain higher salaries. Salaries aren't the only thing, though. This is tough work, and it's very challenging. right now, some recent data says about half of people in public health provider positions are considering leaving because it's been a tough haul with COVID, and it's tough dealing with all the things in healthcare. Half of public health workers are dealing with their own health issues right now, with trauma and depression and anxiety because of the challenges. So we'll also be putting in place some help for our staff to help provide better self-care, because this is tough, and understanding that even some of our staff experience a fair amount of trauma, and helping to identify that, helping them move through that. So it's very, it is competitive. We hope salaries, we hope that the reputation of High Plains will help. And then using contractors who have people who don't want to move to the greatest place in the country, which is just like the best place. It's just like Minnesota, except we don't have trees and water. So, but you know, the people in mental health, to some extent, do not want to live in rural and frontier areas. That's just the nature of people, the personalities of a lot of people in mental health. So what John does and others do allows us to have those people live where they want, but work here in Hayes or Goodland or Norton and see patients, but live where they want to live.
I know that the press release talked about trying to increase access for agriculture workers and farmers. In addition to that, I wanted to know how this program, through this program, you hope to further reach out to rural communities. I know that High Plains has such a huge coverage area here in Northwest Kansas.
So there are several areas. One is through adding school liaisons that will reach out to the schools to help the kids, because our kids are really having challenges right now with increased crises. Schools need that support. Continuing to provide telehealth to our rural communities. The ACT team, which would reach out to people where they're at, as opposed to them coming in to say the Schwaller Center. Providing mental health first aid training more broadly. We're looking at adding a couple of staff to work with Kaylee to do outreach into different population areas with mental health first aid, the veterans community through some specialized training for our staff in helping veterans that are struggling. Part of CCBHC is getting out of the office and into the communities and outreaching, not with just what we do now, but with new ways of supporting people. Jail. Right.
Well, those were most of the questions I had after I read that press release this morning. What else would this panel like to add about this new designation?
Well,
You know-
you know, oh, sorry, go ahead, Kyle.
No, go ahead. Please go ahead, Chuck.
Well, you know, Christina, you know, I give Walt a lot of credit, right? That he is embracing something that is going to really challenge, you know, him and his staff to work differently. And, you know, not many people are willing to, you know, take on those kind of challenges. And, but what I so appreciate about Walt and the leadership at High Plains is how can we better serve our community? How can we be part of something that has the potential to be transformative? And then with the support of Kyle and others to be able to make this sustainable and expandable across Kansas. So it's just so exciting for me to be listen to this and to see the kind of energy and thought and commitment that is being displayed.
I'd
Well,
echo that, Chuck. That
Go ahead, John.
I just got in the, you know, we're in 27 states now and hundreds of clinics, and you have a real community asset there with High Plains and Walt's leadership. I'm not sure folks know that, but, also, he'll joke about being in Kansas, but this is one of the more innovative clinics we have the opportunity to partner with. And it's because of Walt's leadership and also the work that Kyle does with the legislature to really get them to understand the importance of what clinics like Walt does. It's really a great honor for us to be partnered with them.
Well, I
Well-
think that press release also mentioned a community committee that will also be working with High Plains as this rolls out.
No, there
you wanna
there
talk
are
about
two
that a little
ways. Yeah, there are two ways that a CCBHC could set up a governance structure. One is like a federally qualified health clinic for the majority of the board or recipients of services. The other option is to keep the existing governing board, which we really have to because we're part of county government and county commissions appoint our board. But we'll be setting up an advisory group of recipients of services that will be working, we'll be getting feedback from, they'll be providing communication to our board about our services. One thing I did want to call out is there's a gentleman in the room that I forgot to mention, Mark Dinkle. Mark has been, you may recall, the therapist program manager at Westside School for a number of years. And Mark is going to be our program lead for the CCBHC program and helping us build this because there are lots of details in all of this. But yeah, he'll be working to set up a group of consumers of services to give us ongoing regular feedback to help us monitor quality and build services based on what the needs are.
Yeah, that's great.
Kyle?
No, the only thing I was going to add earlier was about the workforce piece, because I think that one of the things that we're really trying to stress, not just in Western Kansas, but certainly it's a great example, is the availability or the opportunity to try a new career that's very meaningful. And so like Dr. Davis from Fort Hays State was on the panel earlier today, and I know that High Plains has a great relationship with Fort Hays State. And then if there's a technical college or Colby Community College has opportunities for people to take advantage of the recently passed state legislation that provides free tuition, and they can become attendant care workers or other entry level staff. LPNs is another good example. Those opportunities then become the opportunity to finish a bachelor's degree and become RNs or case managers. Then maybe that leads them into their graduate school work. So the career tracks have never been more significant than they are right now in behavioral health.
Well, Christina, thank you. We would love, as this progresses, to keep you updated. Maybe get Mark as we get this building up, get you in to visit with Mark, talk more about what we're doing and
Well, I
anything-
appreciate you all gathering today and letting me ask a few questions about this project. It sounds like a wonderful project for our communities here in Northwest Kansas.
Absolutely, absolutely. One of the other things
Thanks, Walt.
I would mention is one of our efforts around stigma and these projects is really raising the bar in terms of marketing and making people aware of services. We've done a lot of radio ads, TV ads. We had banners at the country club fancy golf match, and we've had banners at the rodeo grounds this summer to try to get word out. And you all in the media are, probably the most important player to us in getting the word out, because when we put ads on the radio or we have pieces out on Hays Post, it's amazing the number of people that say, hey, I saw that about High Plains. So we thank you for all of your help in public awareness.
Yes, thank you. We'll be writing a story about this conversation probably sometime next week.
Okay. If there's anything else we can provide, I think we had a slide deck earlier.
Yeah, I can send her some slides. or
Some
she can
slide-
contact me.
Okay, well, thank you.
Thank
All
you
right.
all.
Thank
Take
you.
care.
Thank you all.
Chuck, John, thank you so
Thank
much.
you.
Appreciate it. It's been a great afternoon.
We'll look forward to seeing you in September.
Yes, absolutely. James, thank you very much. My regards to Senator Moran. We miss him in Hayes.